Question 1. Scenario-based question. Mr. Adams, a 45-year-old male, presents with severe alcohol use disorder. He has been drinking heavily for over 20 years and reports multiple failed attempts at quitting. He is now seeking help for the first time. During your initial assessment, you observe that Mr. Adams is in the pre-contemplation stage of change, as he does not believe he needs to stop drinking. Based on the stages of change, what should be your next step in developing a treatment plan for Mr. Adams? A. Begin with motivational interviewing to explore ambivalence toward alcohol use. B. Immediately introduce medication-assisted treatment to manage withdrawal. C. Focus on crisis intervention and refer him to a detoxification center. D. Start a 12-step program to engage him in recovery. Answer. A. Begin with motivational interviewing to explore ambivalence toward alcohol use. Explanation. According to the stages of change model, Mr. Adams is in the pre-contemplation stage, which is characterized by a lack of awareness or acknowledgement of the need for change. Motivational interviewing is a therapeutic approach designed to help individuals in this stage explore and resolve ambivalence about their substance use. Is to increase motivation for change by exploring the pros and cons of continued drinking and guiding the patient toward contemplation. While other interventions like medication-assisted treatment, MAT, or detoxification may be useful later, is the most appropriate approach at this stage. Question 2. Which of the following is the primary purpose of the CAGE questionnaire in the assessment of addiction? A. To identify the presence of a physical dependency on substances. B. To assess the readiness for change in patients with substance use disorders. C. To screen for possible alcohol use disorder by asking about drinking habits. D. To provide a comprehensive evaluation of all substance-related issues. Answer. C. To screen for possible alcohol use disorder by asking about drinking habits. Explanation. The CAGE questionnaire is a brief screening tool commonly used to assess the likelihood of alcohol use disorder. It consists of 4 questions related to drinking behavior, e.g., have you ever felt you should cut down on your drinking? Focusing on self-perception and behavior rather than physical dependency. The CAGE is effective in identifying individuals who may benefit from further evaluation or treatment but is not comprehensive enough to provide a full assessment of all substance use issues. This makes option C the correct choice as it aligns with the tool's primary purpose. Question 3. You are working with a pregnant woman who has a history of opioid use disorder. She is in the 3rd trimester and seeking help to manage her addiction. Which of the following is the best practice for managing opioid addiction in pregnancy? A. Recommending complete abstinence from all opioid medications for the remainder of the pregnancy. B. Initiating methadone maintenance therapy to stabilize her opioid use. C. Discontinuing all opioid use and using alternative, non-opioid medications for pain management. D. Advising the patient to taper off opioid use gradually without medical supervision. Answer. B. Initiating methadone maintenance therapy to stabilize her opioid use. Explanation. The best practice for managing opioid addiction during pregnancy is to use methadone maintenance therapy, MAT, a medically supervised treatment that helps stabilize opioid-dependent pregnant women, reducing the risk of withdrawal and improving maternal and fetal health outcomes. Sudden discontinuation or tapering of opioid use can lead to withdrawal symptoms that may harm both the mother and the fetus, particularly in the 3rd trimester. Methadone has been shown to be the most effective and safe approach for opioid use disorder during pregnancy. Non-opioid medications and complete abstinence may not provide adequate management and can be harmful. Question 4. Which of the following is a key feature of cognitive behavioral therapy (CBT) when applied in the treatment of addiction? A. Focusing on unconscious conflict resolution to address addictive behaviors. B. Teaching patients to identify and change negative thought patterns that contribute to substance use. C. Utilizing medication as the primary means of intervention. D. Focusing primarily on group-based interventions without individual sessions. Answer. B. Teaching patients to identify and change negative thought patterns that contribute to substance use. Explanation. Cognitive behavioral therapy (CBT) in addiction treatment focuses on the relationship between thoughts, feelings, and behaviors. It helps patients identify and challenge negative thought patterns that contribute to their substance use and teaches them healthier coping mechanisms. CBT emphasizes skill building for managing cravings and high-risk situations. It is not a psychodynamic approach that focuses on unconscious conflicts, nor is it a treatment that relies on medication or solely on group therapy. Question 5. In addiction nursing, what is the primary goal of motivational interviewing in relation to patients in the contemplation stage of change? A. To create a comprehensive medical treatment plan and initiate medication. B. To encourage the patient to commit to complete abstinence from substances. C. To explore the patient's ambivalence towards substance use and enhance motivation for change. D. To focus on immediate detoxification and harm reduction strategies. Answer: C. To explore the patient's ambivalence towards substance use and enhance motivation for change. Explanation: motivational interviewing is particularly useful for patients in the contemplation stage where they are aware of their substance use but may not yet be ready to change. The goal of at this stage is to explore the patient's ambivalence about using substances and to enhance their motivation for making positive changes. It is not about forcing immediate abstinence or starting medical interventions right away, but rather engaging the patient in conversation that helps them weigh the pros and cons of their behavior and consider the possibility of change. Question 6. Which of the following is a major risk factor for the development of substance use disorders in adolescence? A. Strong family support and positive role models. B. Early exposure to substances and peer pressure. C. High academic performance and involvement in extracurricular activities. D. Stable home environment and strong emotional regulation skills. Answer: B. Early exposure to substances and peer pressure. Explanation: adolescents are at an increased risk for developing substance use disorders if they are exposed to substances at an early age or are influenced by peers who engage in risky behaviors. Peer pressure, social influences, and environmental factors like family dysfunction can contribute to the likelihood of substance misuse. Conversely, strong family support, emotional regulation, positive role models are protective factors that can reduce the risk of addiction. Question 7. Which medication is commonly used in the treatment of opioid use disorder to reduce withdrawal symptoms and cravings? A. Disulfiram. B. Naltrexone. C. Methadone. D. Buprenorphine. Answer: C. Methadone. Explanation: methadone is a long-acting opioid agonist used in the treatment of opioid use disorder. It helps to reduce withdrawal symptoms and cravings by binding to opioid receptors in the brain, but without the intense high that illicit opioids produce. This makes it a key component of medication-assisted treatment. Naltrexone and disulfiram are not appropriate for managing withdrawal in opioid use disorder. Naltrexone is used for opioid and alcohol relapse prevention, and disulfiram is used to discourage alcohol consumption. Question 8. Which of the following is a common side effect of methadone treatment in patients with opioid use disorder? A. Increased risk of severe liver damage. B. Sedation and respiratory depression. C. Weight loss and decreased appetite. D. Increased risk of hypertension and heart palpitations. Answer: B. Sedation and respiratory depression. Explanation: methadone, as a long-acting opioid, can cause side effects such as sedation and respiratory depression, particularly when taken in high doses or when combined with other central nervous system depressants. These side effects are a significant concern in methadone treatment and require careful monitoring, while other options such as liver damage or weight loss may occur with different medications, are not common side effects of methadone. Question 9. Which of the following is an example of a dual diagnosis in addiction nursing? A. A patient with schizophrenia and alcohol use disorder. B. A patient with hypertension and opioid use disorder. C. A patient with asthma and tobacco use disorder. D. A patient with diabetes and alcohol use disorder. Answer: A. A patient with schizophrenia and alcohol use disorder. Explanation: a dual diagnosis refers to a patient who has both a mental health disorder and a substance use disorder. In this case, schizophrenia and alcohol use disorder represent two separate disorders that require integrated care. Managing dual diagnoses is challenging because treatment for one condition can sometimes exacerbate the other, and a more holistic approach addresses both disorders is necessary. Question 10. In the management of substance use disorders, what is the primary focus of relapse prevention strategies? A. To achieve total abstinence as quickly as possible. B. To help patients identify high-risk situations and develop coping strategies. C. To focus on the immediate detoxification process and withdrawal management. D. To provide patients with long-term pharmacological interventions only. Answer B. To help patients identify high-risk situations and develop coping strategies. Explanation. Relapse prevention strategies are focused on helping individuals recognize situations that may trigger relapse and teaching them coping skills to manage cravings, stress, and other triggers. These strategies include teaching patients how to avoid high-risk situations, manage emotions, and utilize coping mechanisms to stay in recovery. Abstinence and pharmacological interventions can be part of the comprehensive treatment plan. Relapse prevention focuses on long-term success through behavioral strategies and support. Question 11. Which of the following is a critical consideration when prescribing medication-assisted treatment (MAT) for opioid use disorder in pregnant women? A. The potential for severe withdrawal symptoms in the neonate after birth. B. The immediate cessation of all opioid use regardless of pregnancy status. C. The use of benzodiazepines alongside MAT for managing anxiety. D. The avoidance of any medications as pregnancy requires a purely non-pharmacological approach. Answer A. The potential for severe withdrawal symptoms in the neonate after birth. Explanation. When providing medication-assisted treatment (MAT) for opioid use disorder in pregnant women, the primary concern is the potential for neonatal abstinence syndrome (NAS), which occurs when a neonate experiences withdrawal symptoms after birth due to the mother's opioid use. Methadone and buprenorphine are preferred MAT options for pregnant women, are less likely to cause NAS compared to illicit opioids. It's crucial to carefully monitor the infant after delivery and plan for appropriate treatment. The approach to MAT is not to abruptly discontinue opioids or use additional medications like benzodiazepines, which can be harmful in pregnancy. Question 12. Which of the following best describes the role of a nurse in supporting patients during the maintenance stage of the stages of change model? A. Encouraging patients to quit substance use and start detoxification immediately. B. Providing ongoing support to prevent relapse and reinforce healthy behaviors. C. Challenging the patient's decision to maintain abstinence. D. Recommending medication cessation to increase the patient's self-reliance. Answer B. Providing ongoing support to prevent relapse and reinforce healthy behaviors. Explanation. In the maintenance stage of the stages of change model, patients are working to maintain the changes they have made and avoid relapse. Nurses play a vital role in offering continuous support, reinforcing healthy coping mechanisms, and helping patients navigate the challenges of sustaining long-term sobriety. This stage requires motivation, identifying potential triggers, and utilizing relapse prevention strategies. It is not the nurse's role to push patients into quitting again or abruptly ending medications, which could lead to destabilization. Question 13. Mr. Davis is a 47-year-old man who has been struggling with alcohol use disorder for many years. He has recently started attending outpatient counseling and has shown some commitment to his treatment, though he is still ambivalent about making major changes. During a therapy session, he expresses feeling conflicted about quitting drinking, stating that he likes to drink socially but acknowledges that it affects his health. Relationships. What stage of change is Mr. Davis in, and how should the nurse best approach his treatment plan? A. Pre-contemplation. The nurse should encourage immediate action to stop drinking. B. Contemplation. The nurse should help Mr. Davis explore the pros and cons of his drinking. C. Preparation. The nurse should create a concrete plan for Mr. Davis to stop drinking in the near future. D. Action. The nurse should help Mr. Davis reinforce his abstinence through continued sobriety support. Answer B. Contemplation, and the nurse should help Mr. Davis explore the pros and cons of his drinking. Explanation. Mr. Davis is in the contemplation stage of change where he is aware of the negative effects of his alcohol use but is still ambivalent about quitting. In this stage, the nurse should focus on helping him explore the benefits and drawbacks of his alcohol use, enhance his motivation, and discuss the potential consequences of continuing to drink. The goal is to help him move toward the next stage, preparing for action, by addressing his ambivalence and reinforcing his readiness for change. Question 14. Which of the following best describes the difference between tolerance and dependence in the context of addiction nursing? A. Tolerance refers to the physical withdrawal symptoms that occur when a substance is discontinued, while dependence refers to the increased need for a substance to achieve the same effect. B. Tolerance refers to the emotional cravings for a substance, while dependence refers to physical cravings for the substance. C. Tolerance refers to the increased need for a substance to achieve the same effect, while dependence refers to the physical and psychological run on the substance. D. tolerance and dependence are synonymous terms used interchangeably in addiction nursing? Answer: C. Tolerance refers to the increased need for a substance to achieve the same effect, while dependence refers to the physical and psychological reliance on the substance. Explanation: tolerance occurs when a person needs to use increasing amounts of a substance to achieve the same effect due to the body's adaptation to the substance. Dependence, on the other hand, refers to the physical and psychological reliance on a substance, meaning that the experiences withdrawal symptoms when the substance is not available or is reduced, while tolerance is a component of dependence. They are distinct concepts. Tolerance refers to the escalating need for the substance, while dependence refers to the overall reliance on it. Question 15. Which of the following is considered a cornerstone of trauma-informed care when treating patients with substance use disorders? A. Encouraging patients to confront their past traumatic experiences directly in early treatment sessions. B. Creating a safe, supportive environment that acknowledges and integrates the impact of trauma on substance use behavior. C. Focusing on immediate detoxification and pharmacological treatments only. D. Applying strict disciplinary measures to ensure patient compliance with treatment protocols. Answer: B. Creating a safe, supportive environment that acknowledges and integrates the impact of trauma on substance use behavior. Explanation: trauma-informed care recognizes that patients with substance use disorders may have experienced past trauma, which can significantly impact their substance use behavior and treatment outcomes. The cornerstone of trauma-informed care is to create a safe, supportive environment where patients feel validated, respected, and not re-traumatized. This approach emphasizes understanding the connection between trauma and substance use and integrating this awareness into the treatment process. Encouraging patients to confront trauma directly too early in treatment may be overwhelming, and focusing only on pharmacological treatment neglects the emotional and psychological aspects of recovery. Question 16. Which of the following best explains the role of a nurse in managing withdrawal symptoms during detoxification from alcohol use disorder? A. Administering medications only when symptoms become severe to avoid dependency on medications. B. Ensuring a structured environment, providing hydration, and offering medication to manage symptoms according to protocol. C. Allowing the patient to experience withdrawal without intervention, as this is part of the recovery process. D. Immediately transitioning the patient to an outpatient setting once the withdrawal symptoms begin to improve. Answer: B. Ensuring a structured environment, providing hydration, and offering medication to manage symptoms according to protocol. Explanation: the nurse's role in managing alcohol withdrawal is to provide a safe and structured environment, monitor symptoms closely, and administer medications such as benzodiazepines e.g. lorazepam to alleviate withdrawal symptoms and prevent complications like seizures or delirium tremens. Hype and nutrition are also important during this process. Allowing withdrawal to proceed unchecked can lead to life-threatening complications. It's not advisable to transition the patient to an outpatient setting too soon, as the withdrawal phase needs careful monitoring and medical management. Question 17. Mr. Miller, a 35-year-old man, has been prescribed methadone as part of his medication-assisted treatment MAT for opioid use disorder. He complains of nausea, dizziness, and lightheadedness. Which of the following is the nurse's best course of action? A. Advise Mr. Miller to stop the medication immediately, as these symptoms indicate that the methadone is ineffective. B. Reassure Mr. Miller that these are common side effects, but advise him to contact his healthcare provider to adjust his dosage if symptoms persist. C. Encourage Mr. Miller to increase his physical activity to combat the side effects. D. Suggest switching to another opioid replacement therapy, such as buprenorphine, immediately. Answer: B. Reassure Mr. Miller that these are common side effects, but advise him to contact his healthcare provider to adjust his dosage if symptoms persist. Explanation: methadone is a long-acting opioid agonist used in medication-assisted treatment MAT for opioid use disorder. While it can cause side effects such as nausea, dizziness, and lightheadedness, these symptoms are typically temporary. However, if they persist, it is important for the advise the patient to contact their healthcare provider, as the dosage may need adjustment. Stopping methadone abruptly can lead to withdrawal symptoms, and switching medications without consultation could disrupt the treatment plan. Question 18. Ms. Thompson, a 27-year-old woman, is receiving treatment for her alcohol use disorder. She has a history of severe trauma and has expressed a strong desire to quit drinking, but struggles with flashbacks and emotional distress. Which approach should the nurse prioritize in her treatment plan? A. Focus on traditional detoxification and the use of medication to manage withdrawal symptoms without addressing trauma. B. Provide trauma-informed care by integrating counseling for trauma into her alcohol treatment, ensuring a supportive and safe environment. C. Encourage Ms. Thompson to avoid thinking about her past traumatic experiences during the treatment process to prevent emotional distress. D. Recommend abstinence-only approach without considering her trauma history as it is irrelevant to alcohol use disorder treatment. Answer. B. Provide trauma-informed care by integrating counseling for trauma into her alcohol treatment, ensuring a supportive and safe environment. Explanation. Trauma-informed care is crucial when treating individuals with substance use disorders, especially when there is a history of trauma. The nurse should prioritize creating a safe and supportive environment while integrating trauma-focused counseling into the alcohol treatment plan. Approach addresses the emotional and psychological needs of the patient, which is key to successful recovery. Simply focusing on detoxification or discouraging emotional expression without considering that trauma could lead to relapse or further emotional harm. Trauma-informed care ensures the patient's dignity and supports long-term recovery by addressing both substance use and trauma-related issues. Question 19. Which of the following is the primary ethical consideration for a nurse when discussing treatment options for a patient with a co-occurring mental health disorder and substance use disorder? A. The nurse should prioritize treating the substance use disorder first, as it is the most urgent issue. B. The nurse should encourage the patient to focus solely on their mental health disorder, as this is often the underlying cause of the substance use disorder. C. The nurse should emphasize the importance of treating both disorders simultaneously, as they are interrelated and must be addressed in tandem. D. The nurse should avoid discussing the mental health disorder until the substance use disorder is fully treated to prevent confusion. Answer. C. The nurse should emphasize the importance of treating both disorders simultaneously, as they are interrelated and must be addressed in tandem. Explanation. Co-occurring mental health disorders and substance use disorders often occur together and must be treated simultaneously for the best outcomes. This approach is critical because one disorder may exacerbate the other. Treating only one disorder may lead to relapse or poor mental health outcomes. Integrated treatment models that address both mental health and substance use disorders simultaneously have proven to be more effective. This holistic treatment approach fosters the patient's overall well-being and promotes sustainable recovery. Question 20. Which of the following best describes the role of the nurse in relapse prevention for patients with substance use disorders? A. To guarantee that the patient will not relapse by monitoring their every move and providing strict supervision. B. To offer strategies for avoiding triggers, developing coping mechanisms, and reinforcing healthy behaviors to maintain long-term recovery. C. To allow the patient to face relapses, a natural part of recovery, and avoid offering any support during a relapse. D. To solely focus on medication management and assume that relapse will occur on its own with medication adherence. Answer. B. To offer strategies for avoiding triggers, developing coping mechanisms, and reinforcing healthy behaviors to maintain long-term recovery. Explanation. Relapse prevention is an ongoing process that involves teaching patients how to manage stress, avoid triggers, and develop healthy coping mechanisms. Nurses play a key role in providing relapse prevention strategies, such as identifying high-risk situations, building a strong support network, encouraging patients to engage in therapy or peer support groups. Relapse can be part of the recovery process, but a nurse should focus on reinforcing the skills and behaviors necessary to prevent it and support the patient's long-term recovery goals. Monitoring the patient too strictly or relying solely on medication is insufficient for preventing relapse. Question 21. Which of the following is a primary consideration when assessing a patient who is undergoing methadone maintenance therapy for opioid use disorder? A. The patient's ability to attend therapy sessions, as methadone alone will not be sufficient for recovery. B. The patient's family history of addiction, as it will guide the treatment approach. C. Monitoring for signs of withdrawal and managing the dosage to ensure it is appropriate for the patient's needs. D. Encouraging the patient to discontinue methadone as soon as possible to avoid long-term dependence on the medication. Answer. C. Monitoring for signs of withdrawal and managing the dosage to ensure it is appropriate for the patient's needs. Explanation. Methadone maintenance therapy aims to reduce opioid cravings and withdrawal symptoms while minimizing the risk of misuse. Nurses need to carefully monitor the patient for signs of withdrawal or side effects to adjust the dosage as necessary and ensure optimal therapy. Methadone treatment is effective when paired with counseling, psychosocial support. It's important to manage the medication over time to avoid over-reliance, but also ensure that the patient's needs are met for recovery. Question 22. A patient in recovery from opioid use disorder expresses concerns about feeling anxious and agitated. Which of the following interventions would be most appropriate for the nurse to implement? A. Immediately increase the dosage of methadone to manage anxiety. B. Assess the patient's anxiety levels, explore potential triggers, and consider adjunct therapies such as cognitive behavioral therapy (CBT) or anti-anxiety medications. C. Dismiss the anxiety as a temporary symptom and advise the patient to ignore it. D. Encourage the patient to stop all medications, as anxiety can be a sign of dependence. Answer B. Assess the patient's anxiety levels, explore potential triggers, and consider adjunct therapies such as cognitive behavioral therapy (CBT) or anti-anxiety medications. Explanation: anxiety and agitation are common among patients recovering from opioid use disorder, often related to withdrawal or psychosocial stresses. The nurse should assess the patient's anxiety, identify any potential triggers, and collaborate with the healthcare team. Address these concerns, which may include implementing therapy, medication adjustments, or other strategies like CBT. It's important to avoid immediately increasing the methadone dose or dismissing the patient's concerns without further evaluation. Question 23. Which of the following best describes the goal of using naloxone in opioid overdose management? A. To prevent opioid withdrawal symptoms by neutralizing the effects of opioids. B. To reverse respiratory depression and restore normal breathing in patients with opioid overdose. C. To relieve chronic pain in opioid-dependent patients. D. To increase the duration of opioid use in patients on methadone maintenance therapy. Answer B. To reverse respiratory depression and restore normal breathing in patients with opioid overdose. Explanation: naloxone is an opioid antagonist that works by binding to the same receptors in the brain as opioids, effectively reversing the life-threatening effects of an opioid overdose, particularly respiratory depression. Naloxone does not provide long-term pain relief or affect the patient's opioid dependency. Its sole purpose is to counter the dangerous respiratory effects of an overdose. It is a critical emergency intervention and may need to be administered multiple times if the effects of the opioid persist. Question 24. What is the nurse's role in harm reduction for patients with substance use disorders? A. To advise the patient to completely abstain from all substances to ensure success in recovery. B. To support interventions that reduce the negative health effects associated with substance use, such as needle exchange programs and safe consumption spaces. C. To focus solely on the administration of detoxification medications without addressing the social and behavioral aspects of addiction. D. To enforce strict rules regarding drug use, offering support for gradual reduction strategies. Answer B. To support interventions that reduce the negative health effects associated with substance use, such as needle exchange programs and safe consumption spaces. Explanation: harm reduction focuses on minimizing the negative health consequences of substance use without necessarily requiring abstinence. This approach includes strategies such as needle exchange programs, supervised consumption spaces, and education about safer practices. Nurses in harm reduction programs play a key role in providing education, resources, and support for these strategies to improve public health and reduce the risk of infections, overdose, and other substance-related harms. Question 25. Which of the following is an important factor in evaluating the effectiveness of treatment for a patient with a substance use disorder? A. The patient's ability to remain completely substance-free for the duration of treatment. B. The reduction in the severity of cravings, improvement in psychosocial functioning, and the development of coping strategies. C. The patient's level of compliance with prescribed medications alone without considering other aspects of care. D. The patient's willingness to enter inpatient care as it is the only method of treatment. Answer B. The reduction in the severity of cravings, improvement in psychosocial functioning, and the development of coping strategies. Explanation: The effectiveness of treatment for substance use disorder is best measured by the reduction in cravings, improvements in psychosocial functioning, such as work, relationships, and mental health, and the development of coping strategies to handle triggers and stressors. Complete abstinence from substances may be a long goal, but short-term progress should focus on these behavioral and functional improvements. Medication adherence is important, but it is only one aspect of treatment. Furthermore, inpatient care is not the only method of treatment, as outpatient programs and other community-based interventions can be equally effective. Question 26. A 32-year-old male patient recently diagnosed with alcohol use disorder presents to the clinic with liver dysfunction. He is prescribed disulfiram antabuse as part of his treatment. Which of the following is the most important teaching point for the nurse to include in his discharge instructions? A. Disulfiram will help him feel better immediately by reducing his alcohol cravings. B. He should avoid consuming any alcohol, including alcohol-containing products such as mouthwash and cough syrup, while taking disulfiram. C. He can drink alcohol in moderation, as disulfiram will not affect the metabolism of alcohol. D. Disulfiram will allow him to resume drinking alcohol without significant risks if he has been sober for a few months. Answer. B. He should avoid consuming any alcohol, including alcohol-containing products such as mouthwash and cough syrup, while taking disulfiram. Explanation. Disulfiram is a medication used to support the treatment of alcohol use disorder by causing unpleasant symptoms, e.g. nausea, vomiting, headaches, and hypotension. If alcohol is consumed, it works by inhibiting the enzyme aldehyde dehydrogenase, which is involved in metabolizing alcohol. It is crucial to educate the patient to avoid any form of alcohol, including in mouthwashes, cough syrups, and certain foods, to prevent severe reactions. Disulfiram does not reduce cravings immediately, and its efficacy depends on the patient's compliance with avoiding alcohol. Question 27. In providing care for a pregnant woman with opioid use disorder, which of the following is the most appropriate nursing intervention to ensure both maternal and fetal well-being? A. Recommend complete cessation of all opioid use without pharmacological support to prevent harm to the fetus. B. Encourage the use of methadone or buprenorphine in conjunction with prenatal care to manage opioid dependence during pregnancy. C. Advise the patient to reduce opioid use gradually without pharmacological assistance, as it is the safest option for the fetus. D. Discontinue opioid medications as soon as pregnant, confirmed to avoid withdrawal symptoms and potential harm to the fetus. Answer. B. Encourage the use of methadone or buprenorphine in conjunction with prenatal care to manage opioid dependence during pregnancy. Explanation. For pregnant women with opioid use disorder, medication-assisted treatment with methadone or buprenorphine is the standard of care. These medications are considered safer for both the mother and fetus compared to illicit opioid use or withdrawal, which can pose serious risks such as labor, fetal distress, and miscarriage. MAT helps stabilize opioid dependence while minimizing withdrawal symptoms. Cessation of opioids without support or relying on gradual reduction can increase the risk of severe withdrawal and adverse pregnancy outcomes. Question 20. Mr. Harris, a 45-year-old male, has been receiving treatment for cocaine use disorder. During a therapy session, he expresses a desire to reduce his cocaine use, but indicates that he is unsure of how to initiate change. According to the stages of change model, which stage is Mr. Harris most likely in? A. Pre-contemplation. B. Contemplation. C. Preparation. D. Action. Answer. B. Contemplation. Explanation. The stages of change model, Prochaska and Diclement, outlines the process individuals go through when making behavior changes, including addiction recovery. The contemplation stage is characterized by individuals recognizing a problem, in this case, cocaine use, and considering change, but they have not yet committed to taking action. Mr. Harris expresses uncertainty about how to initiate change, which is a hallmark of this stage. In the preparation stage, individuals are ready to make a change and plan how to do so, while in the action stage, they are actively taking steps toward change. Question 29. Which of the following is the primary focus when treating adolescents with substance use disorders in the context of family therapy? A. To identify and punish the family members who may have contributed to the adolescent's substance use. B. To focus exclusively on the adolescent's behavior and treatment without involving the family. C. To engage the family in the treatment process, helping them to understand their role in the adolescent's recovery and providing support. D. To immediately remove the adolescent from the family environment to ensure effective treatment. Answer: C. To engage the family in the treatment process, helping them to understand their role in the adolescent's recovery and providing support. Explanation: family therapy is a key component of treating adolescents with substance use disorders, as the family environment plays a critical role in both the development and recovery from addiction. Involving family members helps to build a supportive environment for the adolescent, addressing issues such as communication, enabling behaviors, and family dynamics that may contribute to the addiction. Effective family therapy fosters understanding, creates supportive recovery network, and encourages healthy family interactions to sustain long-term recovery. Question 30. During a group therapy session, a patient recovering from alcohol use disorder expresses concerns about their ability to avoid triggers in social situations. Which of the following strategies would be most appropriate for the nurse to introduce to help the patient manage these triggers? A. Encourage the patient to avoid all social interactions for the duration of their recovery to eliminate triggers. B. Teach the patient coping strategies, such as using mindfulness techniques to manage stress and triggers in social situations. C. Suggest the patient stop attending therapy sessions, as they have shown some improvement and should be able to handle triggers independently. D. Advise the patient to continue drinking in moderation while at social events to reduce stress. Answer: B. Teach the patient coping strategies, such as using mindfulness techniques to manage stress and triggers in social situations. Explanation: in addiction recovery, it is critical for patients to learn how to cope with triggers and stresses in their environment. Mindfulness techniques help individuals focus on the present moment, manage emotional responses, and avoid automatic reactions that could lead to relapse. Teaching patients to use strategies rather than avoiding social interactions altogether encourages them to build resilience and practice self-regulation in real-world situations. Avoiding social situations may be helpful in the short term, but does not help the patient develop necessary coping skills. Moderation in drinking is not appropriate in addiction recovery, as it can lead to relapse.